Well, good evening and welcome everyone to our monthly COVID-19 updates task force. My name is Kelvin Ampofo. I'm the second district representative of the greatest fraternity on this side of glory, the Omega Psi Phi Fraternity Incorporated. Certainly wonderful that you have joined us on this evening. We certainly want to also thank our Grand Boss List, Dr. David E. Marion, for his leadership, and of course, all the brothers of the second district, which is comprised of the great states of New York, New Jersey, Pennsylvania, Delaware, and Maryland. As usual, we have a wonderful show for you tonight. Uh, Brother 78, Dr. Boykin, is here with us. We also have our good brother, Brother Wonzie Gardner, has joined us tonight, and some of the other doctors are on their way. We have to understand that it is a time where we also take breaks with our families as we've been dealing with this pandemic. But certainly want to welcome Dr. Boykin and Brother Gardner. Good evening, my brothers.
Good
And
evening, Brother DR. How you
yeah,
doing?
Good
I'm
evening.
well. I'm well, my brothers. It's good to see you all. It's good to see you all.
Absolutely.
Well, so here we are. We've been dealing with this pandemic for years now, and it looks like as the COVID cases are starting to decrease, our hospitalizations. We're seeing a decrease in that. Let's just talk about it. Dr. Boykin, what would you say? Where we are today, as where we were obviously a couple years ago when this thing started? How are we looking right now?
Well, good evening, everyone, and thankfully we're looking pretty good right now. I mean, if you talk about the current data, we've probably had about a 43% decrease in the average 7-day caseload. That's pretty good because I look back. Our highest peak was back in July of last year when we had a Delta, and then Omicron hit, but we kind of dropped off precipitously from mid-January to here. So we're doing very, very well. And by the same token, deaths, the 7-day total average for deaths have decreased by 14.5%. And the good news is that the hospitalizations have dropped by about 28.8% 7-day average. Now, that sounds good in terms of hospitalizations, but we still have one problem with dealing with hospitalizations is staff shortages. So that's going to be a reality as we come out of this. And I say come out, and that's putting a little positive spin on it as we come out of this, the heyday of this pandemic. I don't quite think we're over with it just yet, but we're certainly looking like we're seeing some light at the end of the tunnel. The only other subgroup that's not doing that well right now, in terms of the numbers, because they're still having albeit a slight increase, we're having about a 4% increase in children that are being hospitalized from COVID. And we know that in the news, everybody's heard about the delay or the hold on the under 5-year-old vaccine. So, but overall, I think with these uh, statistics showing a very downward spiral, that we're going to probably see a lot of more people trying to get back to some sense of normalcy. You're going to see a lot of jurisdictions doing a lot of things, kind of like they did before COVID, but they got to take it into consideration that we still have some ways to go. So I'll stop at that point and see if my brother Gardner has anything he wants to add to it.
Yeah, certainly. I mean, from a medical perspective, thank you so much, Brother Gardner. From your perspective, where are we now compared to where we started this pandemic?
Brother and Fofo, I'd say we are light years where we are, and I like to echo what Brother Boykin has just talked about. It seems like we've turned a corner, but every time we say we've turned a corner, things continue to get worse or whatever. So we're holding our collective breath to see if we are actually indeed turning a corner. The numbers look good. And I can tell you from the perspective of how we're trying to do a re-entry back into society, re-entry to work for a lot of businesses, corporations, federal government, we're taking a pause. I think everyone's trying to get back to what we consider one sense of normalcy. The question is, what does normal look like when we talk about the future of work and how we interact with each other as we move forward? The reason why I say that's so important is because a lot of us either have been vaccinated or we've been infected with COVID. And so there's some natural immunities that have been built up. But the real question is, what do we do the next time, or how do we go on this? I think Brother Boykin and Brother Jaden Phillips talked about last time. We're in a pandemic. We're trying to get to an endemic. And when we come to an endemic, that means the virus is still around us, but it's more containable and controllable. I think that's what we're trying to get to as our new normalcy. We're all exhausted. We're all tired. We want to get back to what we call the good old days. When we do this process, as Brother Boykin always talks about, we've got to do it decently, strategically, and in order so we don't reinfect ourselves. One of the things I am reminded about as we talk about this, and I'd like to hear Dr. Boykin's point of view on this, is that the last times we've been talking about this, we've talked about that the African American community population didn't get higher than 10% for total vaccination. So that means there's 90% of us out there that did not do that. And I just like to pose a question, Dr. Boykin, from your perspective. How do you see this impacting us if we're going to get back to some sense of normalcy? And yet most of our community was either vaccinated or has not been immune from this thing. And how do you see it playing out with us as we move forward?
Well, I think that's a very, very good question, Brother Gardner. I don't know how we're going to do it, because when I looked at the numbers, we still weren't doing that great in terms of vaccination in our community. When you look at a 14-day period, and that's what I've been reporting on a lot, of 14-day period. When you look at that, only about 15% of people started their vaccination series in the African American community in the last 2 weeks. So that's the first point. The second point, having done that, still only 10% of us have received our first dose of vaccine, and only about 10% of us, are fully vaccinated. So you put those in perspective. Look at the folks that were fully vaccinated, and what percent of folks that are eligible for the boosters have gotten it. Well, if you look at that, only 43% of the people that are fully vaccinated have gotten a booster. So that's going to affect our community, because we have a lot of people thinking that this is not a big deal. We don't have to worry about it. And I know a lot of people have heard about this thing about, if I've had COVID, I don't have to worry about it because I have antibodies. Not true. You do have antibodies, but antibodies don't last forever. If they did last forever, we wouldn't have to worry about an endemic now, would we? So, they do last long. If you've had COVID disease, you do have a period of time where you can have some amount of antibodies, but just like everything else, they begin to decrease over time. And then if you get vaccinated, you have another big swing of that immunity. But if you compare the two together, you have a far better chance of having a longer period of immunity, not forever, if you've been vaccinated. So if you've been vaccinated and had a disease, you probably even have a better chance. That's just panning out now. So I say that to say this, we got to seriously look at our community and see where we want to go with this. Are we going to just take it that we're going to, not have to worry about it because, COVID is over, which is not, because we're going to talk about a little bit later, hopefully, this new BA.2 variant, Omicron variant that's coming about, just like when we started out with the original Omicron, we said, it's not that infectious, not going to have a big deal, but BA.2 is going to have a little bit of different for us there too. So I think that we have, as a community, we have to accept what the transmissible rate is in the community. And if it's high in our community, we just have to buckle down and do what's right. We have to mask. If we're at high, we need to mask. We need to, if we're going to be indoors. If you're outdoors, that's fine, okay? But if you can be indoors and it's running high in your community, then you need to probably mask. Wash your hands and do as much distancing as you can. But I know everybody's tired of doing social distancing, and I get that. I get that. So I say to you, if you are going to be in some place that's closed, then make sure it's got good ventilation. And those are things that we in the African American community have to accept. We are so worried about people trying to do things to us, but we're not taking care of ourselves. We got to take it upon ourselves to do the right thing. If say for instance over here in Virginia, where I'm at, if our community transmission rate is going to be moderate, then I don't have to do as high as, say, someone over in maybe New York, where they're very, very high. So there's a difference between communities. We just have to come together and figure that out and do the right thing.
So, Dr. Boykin, we've been talking about this masking thing. We've been going back and forth, and now even states across the country, some of them are lifting the mandate. So, you say if you're outside, it's fine, but if we're indoors, we should. Let's talk about this masking thing, because I think a lot of people are just, when they see these restrictions being lifted, talk to us more about this masking thing, and then Wonzie chime in from the policy side, because it's like,
Yeah.
Well, the thing with the masking, it's been such a hot button that people forget what we're really in, what we're really doing. This is a pandemic. It's not a political discussion. It's not a debate contest, if you will. So, I agree that, we could probably started thinking about taking the mask away. But if you're in a community, as I said earlier, that's got a high transmission rate, and you go out there, because we know there's a certain amount of people that are going to be asymptomatic carriers of the disease. Well, I don't have fever, I don't have a runny nose, I don't have dust and so I'm going out there, I don't need a mask. But then how many people are you going to infect when you're in close proximity to those other people? So everybody's trying to go back to, because we want to get, the government, as I'll say, wants to get the economy back on track. So part of getting the economy back on track is returning people to work. And part of getting people to return to work is we got to get the kids back in school. The kids need to be back in school for developmental things. I agree. But we can't be sending kids to school that are ill, because you know what? My opinion is if we do that, we're going to turn right around and be right back where we were before. So I'm willing. I'm not naive. I'm willing to try, the mask, lifting the mask mandates. But we have to have a clause in there somewhere saying that, yes, it may be an option, but if we hit another surge or another pandemic, then we need to think about going back to mandating these masks, because we just can be right back where we started from. And I'll yield to Brother Gardner, see if he has anything else he wants to add to that.
Yeah, Brother Boykin, Brother Mfo, one of the things that we look at from a policy perspective is the fact that a lot of our states have gone away from the mask mandates, and that's their right. Dr. Boykin talked about the transmission rates in different areas. And I like to talk about just the DMV area right now. And what we do on a daily basis and weekly basis, we look at a 25-mile radius or 50-mile radius here, and there's 49 counties that are impacting that in that situation. Why is that important? Because that's the area we say people commute from. And right now, for the last 54 weeks, the transmission rate has been very, very high. So what that equates to the fact that they're saying that when people come in from those areas, the likelihood of them having someone in those areas having some kind of transmission capability is high. So therefore, when you're in closed environments, you want to have people masked up. But what is happening right now, because of different reasons, and this is non-attribution, we think that the CDC will eventually go away from the mask mandate inside of buildings, in particular federal buildings. That's the perspective I'm talking about right now. But here's a problem you have with that kind of scenario, Brother Mfofo, is this: that no one can tell you how safe another individual was prior to coming to that building, where they're taking the right precautions and everything else. And in most job and work settings, people are sitting in what they call cubicle farms, or unenclosed areas where you have a group of people in one area aggregating, breathing the same air, even though you might have all the HEPA filters and things you need. I'm now in a community environment. So what's happening is, even though I'm safe, you're safe, Brother Boykin may be safe, if we have one individual who was not careful and they're now in our presence, we have the potential of being reinfected or infected with the virus through no means of our own. So therefore, when we take the mask away, the fear, the different illusions someone's had about what's going on causes different kind of trauma. So we're trying to deal with that as well, because we're in a place right now where people are both exhausted and they're tired of a mask. Don't know if you guys ever tried it, but try and sit in a cubicle in the office for 4 to 8 hours with a mask on. That's very uncomfortable, right? And so we're trying to figure out how to bring people back. So it's a two-edged sword. People want their freedoms, which I agree with, and I understand that. But at the same time, we have to make sure that we protect the rights of others. And how we're trying to do that is something we're still up for discussions. For example, a lot of businesses and organizations are looking at maybe having the workday split in half, maybe 4 hours in the office, maybe 4 hours at home. You can commute back and forth and something like that, because there's so many pieces to this thing. And I just want to say this: although we're talking about that, there's no one size fits all answer to any situation, because everyone's situation is different, every organization is different, and every city and state municipality is different, because the virus may be in different ways. So one of the things we try not to do is give a blanket way of how to do something, but give situations and circumstances and different examples people can use to try to mitigate as much as possible. Because the bottom line is, we're going to come out of this, but as we come out of this, we have to make sure we have the right safeguards in place to make sure we can protect ourselves as much as we possibly can, but at the same time extend those freedoms and liberties that we so ardently earned as we move forward through this pandemic period, as we move forward.
Yeah, I think one of the things that people have forgotten is this is a relatively new disease. Now, everybody's talking about, well, look at the flu. Well, the flu's been around since when? 1918, 1920, whatever it was. So we have a lot of data. We've collected a lot of data on that. The data is ever evolving on this COVID. It's looking really good. And what I found is a lot of people are taking one case point, one data point, and making that the sine qua non. But that you can't do that, because COVID doesn't operate that way. COVID doesn't care about somebody did a study over here to show this, and then somebody did a study to show that. If that were the case, then we could just put this whole pandemic to bed right now. But we got to realize that we are still learning stuff, and people are blaming the medical profession for hiding data. Well, it's not hiding data; it's that the data is now coming out. Everybody want to talk about safety, and that's what this whole thing is about. We got to be safe with the vaccination. We got to be safe with how we manage the disease. Now studies have started to come out that people are trying to extrapolate back to the beginning of the pandemic, which you can't do.
Yeah.
Because you have that data now, almost 3 years going in. So you can't extrapolate back and say, well, we told you at the beginning that you don't need to do this, you don't need to do that. Didn't know at that time, but we know now some different things. So that's what people have to realize when we start talking about going back to normalcy. Don't take the cow by the horns that I told you so, because we just now finding out a lot of things that we can do. And as I said, we're going to have to find out more and more things as we try to make this mask mandate work for everybody. There can be things we're going to need to do, and there can be things we need to study in the whole process of doing this. So as Brother Gardner says, no one size fits all. If that were the case, we would have been done with this pandemic a long time ago.
Brother and Phillips, can I piggyback on what he just said? I work at the National Science Foundation. I work with a bunch of very smart people. I'm not a PhD doctor by no stretch of imagination, but I sit and I listen, and I try to provide the support they need. And this morning I was in a meeting with the National Science Board, and it was a very interesting conversation they had. I think, and Doc, I need you to help me on this. On the vaccine, there was like a 2 or 4 month period that you wait to get your next vaccination, and there's some data out there right now that says no, we can speed it up a little bit or lengthen out, either way. And a lot of people are now saying, well, see, I told you so. They know what they're talking about. But one of our Nobel laureates said this morning, he says, no, he said, people forget that science is a science and it evolves and we learn more. And because of what I told you yesterday is different today does not mean that I did not know what I was talking about before. But as more data and data analytics comes forward, we can actually examine the data. We make different decisions. So decision points are really different. And one thing I would like for our community to understand is, as Dr. Boykin says, not really trying to hide anything, because we do have a bad record when it comes to medicine in African Americans. But this time, as we said before, we've been in the front of this thing. We've been in the game, and things will evolve. Things will change. Some people will die. Some people will survive. But that's all in the nature of medicine and them exploring and understanding. And I remember we had one talk before we were talking about that. Just because we get new empirical data today does not mean what we told you yesterday was wrong. It's just that we have another clearer sight picture now. And hopefully, if this ever happens again, we'll be much better prepared to react and respond in a more concerted effort than we were before, because we learn each day as we go through this process.
Wonzie, that's perfect, Wonzie. That's right on time as we talk about things evolving. And so, Dr. Boykin, continuing on that evolving tip, right? So there's talks now of another variant. So can you just quickly, let's talk about the variants, what that is, and this next variant, I don't want to say new one, this next one, because give us a little bit of information about the latest variant that's out there.
Okay, so when let me just take it back a little bit in history. When Delta first came out, we said there was a Delta. The next thing we know, there was Delta 1A and Delta A1 and Delta A2. Okay, so those are called subvariants of the variant, of the original variant. And likewise, when Omicron came out, we thought it was just Omicron. Then we started saying that, well, no, there's a subvariant. There's BA1, which was the original variant, and then BA2. But we now know that the BA1 is not a real designation, because the original vaccine is the B.1.5, whatever that particular one is. But the subvariant that was a BA1 is BA1.1. And that's the one that has the highest circulation of the subvariants right now. And then there's the BA2. The BA2 is the one that has probably the most ability to mimic the original variant. I mean, in terms of transmissibility and infectivity. Now, there was a big outbreak in France. I think it was last month, the beginning of last month, that they thought it was going to be a very big problem. Then they came out a few days later and said, no, it's not. But I don't think anyone really knows right now, because this BA2 hasn't really reared its ugly head. And right now, it's only about a 3.9% circulation in the United States. And that's in about, I'd say about 11 states and about 60 countries in the world is BA.2. So they're thinking it's not going to be as dangerous in some places. They're thinking it's not going to be as dangerous as the BA1.1. But in other places, they say, oh, but hold your horses here because we don't know. And there are some communities that are showing that it is going to be worse. But that's just like Brother Gardner said, this is today's data. Tomorrow data may change. We don't know because we don't have enough collective cases because, as I said, we only have about 3.9% circulation in the United States of the BA.2.
And Brother Gardner, from the federal side, I understand that there is a map that government uses to determine whether or not government employees can travel. Can you speak to us if you're familiar with how that data is
Yeah.
comprised, and is it updated, and how we're looking as far as which we're talking about, obviously government employee travel.
Well, yes, and each agency is allowed to set their own restrictions or guidelines for travel based on CDC recommendations. And right now, Brother Info, there are no known restrictions for vaccinated personnel. If you're not vaccinated, then it has to be a mission essential type of travel you got to go on. In other words, if you don't travel, the mission of that agency or organization will fall apart. And that's not too many people in that situation. So right now there were no restrictions, and then the quarantine and the isolation periods have also been cut in half because we've been able to generate positive feedback and knowing how to quarantine and isolate people. So they've cut those periods in half a little bit. So again, I liken this to a glide slope. In other words, you can't bring everybody back down to ground zero at once. It's going to try to be a measured approach about how we're going to do this. And so most of your senior leaders are trying to make sure that when we do things, we understand the business of government, the business of business has to go on. But we're asking people in those leadership type positions to make those conscious, intentional moves to make sure that their businesses, their organization flourish, but at the same time, they keep an eye on the safety and the welfare of the people in the workplace and the people at home, because whatever we have in the workplace will eventually ride back at our home stations.
Outstanding, outstanding. So, Dr. Boykin, go back to you. So here we are. There's been talks of yet another. Obviously, everyone's familiar with Pfizer. Everyone's familiar with Moderna. There's talks now about yet another vaccine that, at least from what I'm hearing, they're saying that this new vaccine has 100% efficacy. I don't know if you want to give us a quick reminder of what efficacy means and how you broke it down to us earlier. But what can you tell us about this new vaccine?
Well, this new vaccine is one that's put up by Sanofi. Sanofi is a French vaccine manufacturer. Early on in the whole pandemic, they failed on their vaccination process, so they backed out and they came back around with a second one this time. Now, when you say 100%, let's clarify that a little bit. There's no such thing as a 100% efficacy vaccine, because we wouldn't have to worry about anything. You just take a vaccine and go about your business. But that's not true. So what they're saying, their data suggests in their late phase trials, their data suggesting that it's 100% efficacy, helpful in preventing hospitalization. I get hung up on my words here. So, but efficacy means just ability to do what it's designed to do. Okay, no vaccine is designed to prevent any disease. It's just to cut down on the ability of the disease. So their vaccine 100% means that it's 100% efficacious at preventing hospitalizations, but at the same time, it's only 75% efficacious at preventing moderate disease. So I want to make that clear. And just like I believe it was Johnson & Johnson, I believe it was when it first came out, their data was saying they would have very high rates in their late phase trials, but they had to come back and change that because as time went on and the data kind of evolved a little bit, it wasn't quite true. So this is just coming out. I'm not sure if they're going to apply anytime soon for emergency use authorization, but I think they're going to see that might change a little bit. I'm not here to bash them at all, because hey, if any vaccine can prevent 100% hospitalization, I'm all for it, because right now the hospitals are stressed out,
Yeah.
Short staff, people quitting, walking up there because they're just tired. Everybody's just tired of this. But I wanted to be clear that it's 100%. The data shows 100% at preventing hospitalization, but only 75% at preventing moderate disease.
Hey, Brother Boykin, Brother Info, if I can add that, Brother Boykin, can you repeat that again about the fact that vaccines were not designed to prevent you from getting the disease, but prevent you from dying? Because I think that's one of the biggest misnomers people hear when they talk about the vaccine, that I've got it, so therefore I can't. And I think we need to stress again the fact that that's not the case for a vaccine.
Right. Vaccines were never designed to be 100% preventative. 100%, I mean, you don't get the disease. what they're designed to do is cut down on your chance of getting disease and serious illness from it. So that's why you see things like efficacy. The mRNA vaccines at 97% efficacy. That means you have a 90 some percent chance of not having a bad outcome from the disease if you would get it. Just like people get the flu shot. The flu shot is only like 60% efficacious, but a lot of people get it. A lot of people never have flu during the flu season. So that's pretty good for a 60% efficacious vaccine. But then there's some people, myself included, that got the flu vaccine. I think it was probably about 3 years ago before I retired, got the flu vaccine, did very well. I got it early on in September, did very well. But then along came January and that bad flu bug came out. And guess what? I got that flu bug. But I shudder to think how sick I would have been had I not got the flu vaccine at that particular time. I probably would have been very, very, very ill. And this is the same thing people need to understand, that, okay, if you want to take your chance to get COVID, that's just your prerogative. But, there are all consequences for getting COVID and not being vaccinated, such as heart disease and long-term COVID disease. But if you take your chances of getting a vaccine with very little side effects that we're seeing so far, other than the flu-like symptoms we talked about before, and your chance of getting hospitalization and or death are decreased, I don't know what people think, but I would rather take that chance than take my chance of, playing Russian roulette with the COVID virus in and of itself. So you're right, Brother Guyton. Nothing is going to be 100% preventative. That's why I wanted to clarify this about the Sanofi vaccine, because they're saying 100% efficacious, but preventing hospitalization, not preventing disease.
So let's talk about one of the things, and Dr. Boykin, you alluded to this earlier, and Brother Gardner, I'm sure you would certainly agree. One of the things that we want to continue to do during these times is we want to continue, just like we've heard, wash our hands. I want to talk about getting tested. Should people get tested on a regular basis? Do they only need to get tested if they think they have, or if they are experiencing symptoms? Let's talk about testing. Personally, I go every week just because of the travel that I do. So I've got it as a routine. And so I've got all the stats in history, everything is negative, thank the Lord. But should people continue to get tested, or only if they have symptoms? What's your thought on continued testing?
Well, my personal opinion is that you should have a plan, and that should direct your testing. But I mean, a plan, like if you know you're gonna be going somewhere, say to a large convention like I went to last weekend, if you know you're gonna be going there, then start planning for that. And I use rapid testing in there, but you can also do, if you want to get your PCR, but your PCR should not be, in my opinion, and I think the data will back me up, shouldn't be more than 72 hours out from where you're going. So now, if you get the test and it's negative, doesn't mean like, you have free will to go and do whatever you need to do. You then need to start doing things such as self-quarantine and, like decrease your contact around other people. All right. And everybody else is coming to that same place you're going to be at. They probably need to do the same thing. What I did was I took a rapid test about 48 hours, only about 36 hours before I left to go to the convention. And 24 hours later, I repeated that test the day of, and both were negative, obviously. And then I went to the convention, which is a whole day. And I came back, and I know that, in the first 2 days of exposure, I may have a negative test. So I waited 48 hours and did another rapid test, and it was negative. So I used that to say this: you should have a plan. I don't think, my personal opinion, you should go out and just test yourself, except for cases like you do, Brother Pofo, where you do a lot of travel. But if you're not going to be doing a whole lot, you don't even really test yourself that regular, that often. If you're symptomatic, always test yourself, regardless. You need to be tested. And if you have symptoms and it's negative, don't stop there. Go see your primary care physician and get a PCR test to make sure you are truly negative. Because that's how disease has been spread in the past. People say, "Oh, I got a negative test, did it too early," or they did it and thought it was a false negative. So that's my take on it. Is have a plan. Go somewhere. You're going to go somewhere. You're going to be around people that are vulnerable to the disease. You should test yourself. If you're going to go to a large crowd of people where you're not going to be able to practice social distancing, and the mask mandates have been lifted, test yourself. Because you're not only protecting them, you're protecting yourself with what they may bring to the pot. So that's my take on testing. I don't know if Brother Gardner has a different.
I liken it more to almost like personal hygiene, just like taking a bath. Okay. And if you, and I'll just use myself for example. I think since the 20th of January, I've been in Georgia, came back home, then I took a road trip with my son out to Washington State, from Washington, D.C. So I took a rapid test before I went to Washington State because I knew I was going to be in the car with my son. We were stopping different places. Didn't do it in Georgia. I should have because my sisters and I were coming from different places. And then we came back and so I took a test in. And when I got back here before I went to work, I took another rapid test. Didn't go to work that following day because I wanted to make sure and see. I went in today. And so I tell people it's like personal hygiene. If you know you're going to be interacting with people that are not in your normal circle on a daily basis, you're doing something out of the ordinary for your lifestyle, you should try to get a test. And I liken this to this. I tell people all the time, my rights end where your rights begin. So I've got to make sure that when I'm doing things for me, I'm not putting anyone else in jeopardy. So I liken those tests to making sure it's a safeguard, not only for me, but the persons around me. Because I tell people this, we are a collective. And until we start thinking like a collective, we won't be able to really control this virus the way we could have. I'm not going to get into politics, but if we had started with a collective, everyone, all hands on board, it wouldn't have got this bad. Because I think about those 900,000 souls that are lost right now, because we could have probably saved some of those if we had a collective effort in what we're trying to do. So as we come out of this pandemic, I think we should all keep our guards up as much as possible. If you're doing something out of the ordinary for you, make sure a test. Or people travel like a lot like you, Brother Info, for other people, you've got to test on a regular basis so you have some kind of baseline to know. And above all, if you're feeling kind of different, even though you don't have any other symptoms, just remember we're still in the pandemic. And the symptoms are different for everybody. Just because you're not falling over does not mean you don't have COVID.
Right.
Does not mean you're not spreading anything. So we've got to look at testing as that second line of defense, because that first line of defense is washing your hands, keeping yourself clean, right, and making sure you're in those right areas. Third one, I think the second one would be those masks if you're indoors. And the third line of defense is a test to make sure that if you've been in those kind of areas, you can take care of yourself. And if you are exposed, you're going to need to understand what quarantine and isolation mean so you can mitigate those risks to other people. Because I like what Dr. Fauci said. It's not a matter of if at one time, it's a matter of when, right?
Right.
And we know that these things can happen to people. You got to have a plan, like Brother Boykin just said, to be able to mitigate it for yourselves and your family. We are our brother's keeper, so we have to make sure we do everything we can possible to mitigate as much as possible. And so these steps will help you mitigate those as we move forward.
Brother Gardner, do you have any updates as it relates to the home kits that are being provided by the government? Those persons that applied for them and they haven't received them, or any updates at all with those?
Well, you know what? It's funny you just asked. I just got my kit test today. I got my 2 today. I had gotten some from work earlier, but I got my 2 in the mail, and I think I ordered mine the second day they were out. So I don't know if anyone else got theirs. I do know this package is a blue one with an FDA seal on it, whatever. The ones I've been using for are orange. I'm hoping they're just as good, but I've got my 2 in today. And I understand, Brother Boykin, correct me if I'm wrong, it's only 2 per household or 2 per address. So if you get something sent to one address, I don't care if you got 10 people in the house, you're only going to get 2 for that particular family. And they're trying to figure out if they need to roll out some more later on. But if this pandemic continues to subside the way it is, I'm not sure what they're going to do. But I did get my first test kit today, and I'll let you know tomorrow whether it works or not. Okay?
Well, I think we're gonna go to some of the questions we're getting, because I think you just answered one of them. So I think Colonel Bracy, he wanted to know how effective the home kits were that are provided from the government. So as far as we know, Brother Gardner, you're gonna check it out and let us know.
I'll let you know tomorrow, but I'll leave that to Brother Boykin.
Well, I got mine, and it sound like you got the Binax one.
Okay.
The orange ones were the eye health, and that's the ones I use. I like those. I tried to use one of the Binax on one of my friends at the house when I went to this convention. That thing was so complicated, so complex that I gave up on it. And I just my church gave out. My church was able to procure a certain amount of them. And so on my way down, I was able to get 2 more kits. Each kit has 2 tests in it.
Right.
And why they have 2 tests in it, because that particular one, the orange one, you talk about the eye health, they recommend that you test yourself and do a test no sooner than 24 hours later to make sure it's accurate. But, I don't know if you really need to do that if you're not going to be that sick or that ill. But if that's the way to test it, I'll just leave it at that. Okay. And so, they're still out there. I mean, as a matter of fact, they're still advertising on many places to go to, covidtest.gov and pick those up, because a lot of people haven't gotten it. I got mine, and I got more. And I walk in the stores right now, these pharmacies, and they're readily available on the counter. If you want to know which is the one that's the best one to answer the questioner's question, is that you can go to I believe it's the CDC website or the FDA website and see which ones that FDA approved. I do have a list of those. I just don't have them handy right now. The ones that FDA approved. If they're FDA approved, then you're pretty much certain that they'll work and they're pretty confident about it. But anytime you got a test, you're not sure, go get tested somewhere else to get it again. Go to your primary care and get a PCR, whatever you need to do. But if you use one of those that's FDA approved, I feel pretty comfortable as a physician that you're okay if you have no symptoms and had no significant exposure.
Dr. Boykin, what's the difference for our audience? What's the difference between a rapid test and a PCR test?
Okay.
What is different?
A rapid, good evening, Brother Guyton.
Yes, good evening.
There he is.
A rapid test just tests.
There he is.
Is just a quick test to test for the presence of antigen in your nose. And people are afraid of those tests. They think they have to jam it all the way up their nose. But the eye health test only goes up a certain small amount in your nose. You're just wiping it both sides. And you're not contaminating yourself if you do both sides. So that's a rapid test. A PCR is sent off where they actually do a more in-depth testing of, and I forget the exact mechanism to make it easy for people to understand. But that's one that they do more in-depth testing of the viral elements, if you will, not the antibodies. Now, these are both viral testing, okay? The rapid antigen test just tests for the presence of antigen in your saliva. If you use a saliva test, I don't think too many people are using those, or the nose swab test. Whereas the other one's sent out to test for the viral particle, the viral elements in your particular saliva. As a more in-depth test and a test for some of the I guess nucleic problems of the. Speaking of which, Dr. Guyton is here. I mean, he might be having a little bit more insight on that as well. So.
Yeah, there it is. We're gonna let him get warmed up. Dr. Guyton, it's good to see you. We know you was on the road traveling. Glad to see that you made it. And I know the guests are definitely glad that you're here. They've been waiting for you. So we're not gonna call out no names, but
please don't.
Before you get started, Dr. Guyton, let's see if our outstanding producer and engineer, if he can put up. I saw one question looked like from Miss Mary Bynum as it related to being fully vaccinated. If I'm fully vaccinated to include booster and was given an antibody infusion for Omicron in light of this new subvariant, would I still need to receive additional boosters? Any of the doctors?
I'll take that. The new guidance out there, the new CDC updated guidance is that for that fourth, they're actually calling a booster now. Fine, not a fourth dose. They're actually calling a booster now. So if you were immunocompromised, then you should get the fourth one. If Mrs. Bynum doesn't have any underlying illnesses or anything that would put her at risk, then no, you don't need to get an additional booster. But always check with your primary care physician, because I'm not practicing medicine here. I'm just trying to give you some information. But if you're immunocompromised, the new recommendation now that you should get a fourth dose or a booster, which would be a fourth injection, about 5 months after you had your last booster. So to that end, I'm getting mine on Friday. So I'm getting my fourth dose on Friday. But no, if you and I'm a little bit cautious about the infusion against Omicron, because they have recently said that those things do not work. Mm-hmm. So I would not rest my laurels on that, being that you got an infusion against Omicron, because they found that some of those things, antibody preparations, don't work. But if you're not immunocompromised and you've had your booster, all three of them, if you have the mRNA, or two if you had the J&J and one additional booster, you probably don't need an additional booster. But again, as I said, check with your primary care doctor, because he or she would know better than I do what your underlying situation is.
Sounds good. That sounds good. Dr. Boykin, we're going to give you a shout out. Your baby sister's on here. So she said, Janice, she says, great job. Thanks for joining us, Janice. Dr. Guyton, go ahead and chime in on that.
Good afternoon, everyone. Good evening. So one of the things that we are looking at now is a paradigm shift for what we use testing for. As we continue to see the symptoms and symptomatology of Omicron not impact those who are vaccinated as it does for those who are unvaccinated. We're still seeing hospitals still having overwhelming issues with those that are unvaccinated. And the age is now between 30 and 40 where we're seeing this issue. The dissemination of the testing is now going to be, again, like Brother Gardner said, having a plan. I know that when I travel, my plan is I check the zip code and the area code where I'm going. For instance, if I'm going to Thomasville, Georgia this weekend, I've already checked it's 50% of the people there are vaccinated. I looked at the 7-day trends. I have my 2 tests that were delivered here. I have my mask, my gloves. My mother's triple vaccinated, and I know where I'm going to be. But with that said, my children are traveling. So my children fully vaccinated. They're going to a tournament in Texas. So they're playing also because once we start looking at how we use these rapid tests, the rapid tests are good for simply verifying, checking to make sure that, if we've been exposed. But the PCR test is the most dynamic of those tests that can really provide you with more than 80% of positivity or giving you correct diagnosis, because we worry about some of the rapid tests not being as effective. They can be impacted by temperature. And so it's very important that you follow the storage recommendations for those tests. Let's talk about having a plan. I know I'll be traveling. I know my kids will be traveling. Let me back up and say I had the scare of my life. In a 3-week time period, my 11-year-old had COVID, and my mother, who's 71 years old. She had COVID, and she has diabetes, and she has high blood pressure. Oh, and asthma. We had a discussion. We were on the phone. I said, Mama, thank God that you're okay, but realize you need to think that vaccine that you took. I said, because you are a living statistic to what effectiveness the vaccine has protecting African American female 71 with asthma as well as diabetes. And all you had was a sniffle. My mother and I got triple vaccinated on the same day. It was a family thing. I got my booster here. She got her booster there. You know how she determined it? She went and got tested. She went and got tested in one of the free testing clinics there in Thomasville. And that's how she determined that she had it. She quarantined, but the testing does work. Understand, do not take lightly and say it's allergies, like she was saying. I said, Mom, go get tested.
Right.
In this new environment, let me beseech you, do not assume it is allergies. Omicron presents in multiple different ways, especially if you're vaccinated. Omicron still can be passed if you're vaccinated and you catch it. So be careful. She had a plan. She also had a resource in her life to help her. Many of us don't have people with resources, and we need to become resources in our community to give them that type of feedback. Get tested. It's not just the sniffles. It's not just allergies. We have to assume and then rule out for Omicron. Now, the new variant, we're looking at a new variant that's coming along. And as we continue to see the more people get vaccinated and the vaccines are working, we hope to get over this pandemic, and we're looking at past summer. And that's only if we have the plan. We keep testing. We keep following the protocols, the gloves, the mask, the distancing. I know it's very, very controversial now when it's mask, but if you're flying in an airplane, wear your mask. You're in a contained space within people within 6 feet for more than 15 minutes. You need to stay masked if you're flying on an airplane. Perfect example, I just left my children go to a gym they're practicing for cheerleading. They're masked while they're practicing. But they still got sick at that gym being masked. The close proximity, the fact they had to take it off to drink water. We're still dealing with a very, very contagious virus here. Now, let's talk about the new oral medication that is available. And is only available to a small group of people, immunocompromised, those with other ailments. Not all of us are going to qualify for that drug. So please understand, and it's a window, not mistaken, it's between 5 to 7 days. You've got to get that medication in your system. Right. Also, you got to make sure that you got good liver function. It's a number of determinants that allow you to get this oral medication. The infusion, the FDA put out an advisory early in January. They said that infusion does not work on Omicron, and they're not advising you to use the infusion anymore for Omicron. I'll stop there, brother.
Let me just, Ms. Bynum said she didn't get the question. So just to repeat for her, if you're still there, Ms. Bynum, as I said earlier, first of all, check with your primary care physician, whoever he or she may be. But if you don't have any underlying problems, if you're not immunocompromised and you've been fully boosted, then you probably don't need a fourth dose booster, unless, of course, you are of an age group that may need that.
Mm-hmm.
In terms of the Omicron infusion for the Omicron, brother Dr. Guyton just said that back in January they recommend stop using these infusions because they were not effective against Omicron. So I would not use that as a means of saying, well, yeah, I'm good because I have the Omicron infusion. I would infusion against Omicron. It may help against Delta or some of the other variants out there, but not against Omicron. So I would say to you, again, if you have no underlying problems, you don't have a cancer or organ transplant or diabetes or high blood pressure, neurological disorders like multiple sclerosis or any other autoimmune disease, just to think of a few of them off the top of my head, then you probably don't need a booster. But again, only you and your primary care know what you truly need, and that's where you should be getting your final answer from.
We got about 10 minutes left, and I just want to just go back to what we've been talking about, mainly as it relates to evolving. And all I want to go back to is the testing, right? So obviously, when this thing first came out and we were getting tested, I think the way I described it was they put this thing on my nose and it was scratching the back of my eyeball. It seems like now
The back of
they
your
just,
eyeball.
now it's not that deep, So what changed? Is your point about as things have evolved, they've realized that they don't have to go as far? What has happened so that the testing is not the same? We can talk to that.
Well, I think they finally realized that you can use, and please forgive me, folks out there, in and out of snot can't even work. Because when I was used to do these tests on kids, because only physicians could do the test on kids in pediatrics, they were ramming all the way back up the nose. But we realized later on that you don't really need to do that. Matter of fact, I used to have kids just blow their nose on the Q-tip, and I got a lot of positive tests out of that in and of itself. So, you don't really need to do that. So, we know if you go at least about, 2/3 of the tip up your nose, probably just almost to the part where you think it's gonna scratch your eyeballs. That's right before that part, and that's all you really need right now. So, and they're just as effective. It's just as effective. So.
Brother DR, I can tell you, on your military bases, they're still touching your brain. I've been tested 3 times. They're making sure that you are accurate testing. The testing is a tool now. It is going to be there's going to be a diagnostic tool and a survival tool going forward until we can get this thing under control. And I see Wonzie brought it up. Testing can have a mental impact on you. The anxiety that comes along with it. You got to realize for over 20 something months, we've been fighting an invisible adversary. Right. Unlike any other war that we have where you can see the tanks and the helicopters, like Russia right now, we can't see this. We don't know the impact of it. We don't know how far it reaches. We don't know if it's around us. This has been, some people call high blood pressure the silent killer, but this has been an enormous silent killer. So the anxiety that goes along with testing, the anxiety going along with a diagnosis can impact people for years. It can impact you, your family members, because I know the minute my daughter was sick, the entire house changed. Mm-hmm. The minute my mother was sick, my entire day and night changed. And to have to deal with that back to back in a week, that's not something you are going to easily forget, especially seeing all the death I've seen, all the people we've tried to take care of in these communities, all the officers I put in harm's way as they go out and try to save lives in multiple hospitals and in communities. I pray about it all the time, but the mental health impact of it is not underscored here because this silent, invisible killer is still out there. How do we beat it? We've held it back for a while. We've still lost 900,000 souls. What do we do next? And that's what a lot of people are thinking. We still have this community that's out there that believes no vaccine, just get sick and you can deal with it. Well, we got 30 and 40-year-olds dying now. Mm-hmm. You understand me? It is not the 20 to 25 years, the 30 to 40-year-olds unvaccinated that are dying now. This vaccine would not prevent you from getting it, but it prevents you from being hospitalized. It prevents you from dying I'm a living witness to that with my family.
Hey, brother Guyton, you hit a nerve with me on that about that mental health piece of it, because I've been a book, an open book to you guys, my struggles with my losing 3 family members. And you hit something. You said it takes a toll on your body. I got to tell this quick story. I went to get a physical about a month ago, and I thought everything was good. My heart was racing fast, numbers look good. And I have a new primary care doctor in executive medicine, and she was talking. She says, Wonzie, what's happened in your last 6 months? Nothing. What's going on 9 months? Nothing. She said, Wonzie, something's not right. I've done all your tests, we checked your heart and everything, but your body is not responding to something. And she's looked at me and said, has anything gone in your life? I said, oh yeah, I lost my mom and my dad, my daughter, all within 7 months in 2020. And she looked at me and said, you're clinically depressed. And, we're all family here. And I said, no. I called my psychiatrist because I told you guys I'm seeing a psychiatrist. And she said, Wonzie, very gently, she says, Rose said, Wonzie, I told you that you're going through some things. She said, your body will, if you try to subjugate things and hold things on your body, at some point in time will show the effects. I've been running, dealing with this for 2 years, not only my family, but trying to keep everything together. And it just showed up. And, as we as Black Americans, we're too proud to say that we need help. I got the mental help and everything, and we're family. I talked to my psychiatrist and my PCM, and they said, Juan, we need to give you something to slow your body down. And I've been taking medicine for a month, not saying that boasting, but you talk about the cause and the effect of what's going on. She says, Juan, we got to get you at a level because your body is tearing itself up. You're putting on weight. Your slugs, your numbers look good, but from a clinical standpoint, something's not right. And for this doctor to know that about me, it shows importance of going to doctors, number one. Number two, it's very important to be open and honest with yourself and others around you and say it's not a sign of weakness, say I need help. I mean, I miss my mom and dad. I grieve my daughter. Every time I think I'm over something, it's different. I saw her within 9 days. I went with my son. We drove to Washington State. My wife and I went to Nashville to bury my ROTC instructor. I stopped by my daughter's grave, and I looked at that, and I said to myself, well, my daughter want me to be going through this, trying to handle this on my own. And the answer is no. And I know she was a hypochondriac, and she would go to the doctor all the time. And I could hear her now say, Dad, you need help. Dad, if you're my dad, you'll get the help you need. The doctor tells you need medicine, take it. Don't be too proud. And I think of my daughter that way. And I think of things like that. And so my message to my brothers and anyone else to listen right here, don't be so strong that you're killing yourself.
Right.
Don't be so strong that you won't get the help you need. And I don't say this out of shame. I don't say that out of embarrassment or anything like that. I just say it because I just think it's very important to have what we call real talk. We talk real issues. As Brother Guyton said, this thing is an invisible killer. And I feel like I've been on the battlefield for 2.5, 3 years almost. I go to bed and can't rest at night, get up, can't sleep all the way through. I can't tell you the last time I've had a real good night's sleep. And so I'm trying to get back that sense of normalcy. You guys hear me say all the time, trying to find my way. Well, there's 900,000 other people out there. They're lost people that are trying to find their way. And I just hope that some of the things we're telling people tonight and the other nights all through these last 2 years, people get it and say, look, this is for real. And the consequences, the people left behind, that's what you got to think about. Not you, what you leave behind. So, Brother Guyton, thanks for that little plug about mental health, because it's very, very important that we talk about these kind of things.
Brother Gardner, I'll say one more thing. Realize something. When we go out and we're in public, what are we doing now? We're thinking that everyone around us is a threat. Your body's now in a threat, in a prevention and protection mode. That causes tension. That causes stress. You're going into areas where you don't know, if you're going to take home a deadly killer to your children.
Right.
Parents, do not think that this is a joke. Your kids are in these school systems are being utilized in some ways, and this is Cedric speaking, as political pawns.
Right.
Protecting your kids should be your utmost responsibility. You're not taking their rights away by protecting them or protecting the student next to them. I can tell you again, my daughter was back in school 4 days after a break, and she was sick because a child did not have a mask on, and they were eating at lunch. The child went back to the classroom without a mask on. You're having parents that are not understanding that when their rights impede my rights,
Right.
we have a problem.
Right.
And again, this goes back to a simple mentality of people are tired. People are simply scared and sick and scared of being tired, of being worried about, are they going to wake up in the morning? You know, and I don't want to joke about it, but, I got an analogy. We were worried about HIV taking us out in months. Well, COVID takes us out and can take you out in 2 days.
Mm-hmm.
Mm-hmm.
So think about that stress that we're putting into our communities, and it's showing. Mental health and suicides are increasing throughout all communities, and in our community, we use it as it's taboo. We don't want to be
Right.
considered. We call it crazy back home, or you
Right.
got something wrong in your head. It
Mm-hmm.
can be that you're just depressed and stressed.
Yeah.
Stress will kill. You know, reach out, find your brother, find your sister, see if they're okay. I'm going home for one reason only, to put my hands on my mother, because the stress is enough. I
Mm-hmm.
work every day in a stressor environment, but that stress of knowing she was sick, and I haven't seen her, is enough to make me get on that plane tomorrow or Friday with a mask on.
Go see mom. Said, go see
Yeah,
mom.
Yeah, go
Go
yeah.
see
see
mom.
mom.
That's
Go see
powerful.
mom.
That's
Go see
powerful.
mom.
As always, the four horsemen,
Go see mom.
even in the absence of Dr. Jedan Phillips, y'all still come through. Listen, we got about 2 minutes left. Let's do our 45-second or less closing. Let's start with you, Dr. Boykin. What's the takeaway message you want our listeners to take into consideration, be mindful of until we meet again at the end of the month of March? Dr. Boykin, your closing remarks.
So thank you very much, and thank you everyone that's come out tonight to hear, because I want to say one thing, and one thing perfectly clear. We may be seeing the light at the end of the tunnel, but it's still not time to let our guards down. I do believe that we can get to where we need to get to if we all think collectively, as we said on this thing tonight. Be smart about what you do, protect yourself that you can protect others. Don't get caught up in the great debate and the great political thing, because we know that this is a disease that can kill us, or can harm us long term, or can cause mental health. Our children are afraid. Our families are afraid. So we got to do what we need to do, what's right for them. Have a plan is my biggest thing I want you to understand tonight. If you are going to go where a maskless environment is, by removing the mask mandates, and you are afraid, no one's going to be upset at you if you want to wear your mask. It is your right to wear your mask just as much as they say it's their right not to wear a mask. Protect yourself, protect your family, so that we can continue to move to the end of this pandemic. Thank you very much.
Thank you so much, Dr. Boykin. Always appreciate you and the information that you share with us. Let's go to 1990, Brother Gardner.
Brother Amphopoulos, thank you for allowing us this opportunity. Don't hardly have too much to say. I've kind of bared my soul, and I say that to say that I'm hoping that if someone under the sound of my voice can hear what I'm saying and take a little courage in knowing that I'm too walking the same path that you're walking on, and realize that there is a light at the end of the tunnel. And if you are feeling damaged mentally, that's okay. It's okay. As we said earlier, in our community, it's a stigma. Well, I'm a living witness. It's not a stigma. It's just a realization and a recognition that you need help. Most of us are A+ type individuals. We feel like we can solve everything, but some things you just can't solve. When inside your head, you can't do that. So I beseech you and implore you, if anyone is having any thoughts of anything that's contrary to your good well-being, please go see a psychiatrist and your doctor and tell them what you're feeling, because there is help out there for you. Thank you, Brother Mfofo.
Thank you, Brother Gardner. As always, you sharing your story, it's important that people hear it because people are also experiencing the same. And so when they hear it, it allows them an opportunity to also move forward. So thank you so much for sharing your story, Brother Gardner. 1991, 7D, Dr. Guyton.
Brother DR and the audience, I really want to thank you for giving us this opportunity to take the time out of your night to just listen to us. We've come through a fog for over 22 months, and we continue to fight through this. We fight through this with what? With truth and with transparency. We are and have been in the worst pandemic in the history of America. Our communities do not and did not believe in utilizing a vaccine, but this vaccine is saving our lives. What we can ask you to do is please support those around you with accurate information. Continue to be COVID ambassadors, continue to tell the truth, continue to support them mentally, and continue to ensure that they have a plan. If they have a plan, that ensures 1 to 2 people around them may have a plan as well, and it can help curb this pandemic. We are almost at the end of the light is at the end of the tunnel, and we are making sure it's not a train this time as we did before when we laxed our regulations. Every state where I live has seen a decrease in all 3 straight states, and they're lifting mask mandates daily in our area. The sentinel event for me was when they reduced and took away the mask mandate in New York. New York was the hardest hit. We're at a time now where we need to be very smart. We need to have a plan, and we need to continue to utilize accurate information. And please, don't get in an argument about why they didn't get vaccinated. Support whatever they're thinking, but make sure you have a plan that they don't impact your life. They don't impact your family's life. Your children are the most important things out there. Your loved ones, continue to support them, because at this point, we're all a little fatigued with having to be on guard every day of our lives.
Dr. Guyton, thank you so much. And certainly we want to make sure we acknowledge all of our brothers and sisters of the NPHC who have joined us on this evening. Thank you all so much. Our friends, our guests, our family. As always, you know the disclaimer, all the information you heard tonight, the comments, those comments are of those individual brothers. Doesn't represent any job or any entity that they may be affiliated with, including the Omega Psi Phi Fraternity Incorporated. I want to thank the brothers for joining again every night and certainly every month on this webinar. You see that we were all decked out in our African dashikis in celebration of Black History Month. It is important. I certainly want to acknowledge all the programs that have occurred this month. It's very important that we honor our past, that we celebrate the present, and most importantly, we inspire the future. So again, thank you all so much for joining. Next month, the entire month of March is Red Cross Blood Awareness Month. So we want to make sure that we're donating blood. So make sure you take the time to go out and donate blood. To our producers, Brother Piercy, Brother Worley, Brother Brown, Brother Ed Hill, thank you all so much. Certainly, shout outs, birthdays, our first Vice District Representative, Brother Delrico Gales, his wife's birthday today, and our Corridor 3 Representative, Brother Harrison Potts. So happy birthday to you all. Hope you all had a wonderful day. And so with that, we will see you next month on the last Wednesday of the month. Take care, stay safe, stay well. God bless you.